I'm Chris Williams. I'm the Director of Communication Operations in the Davis School District. We have a fantastic relationship with the Davis County Health Department. We've been meeting with them since the last week in February on a weekly basis, trying to get through the COVID situation that we're currently involved in. In one of those meetings, the Director of the Health Department said, maybe there's a way that I could come up with some CARES money to help you out. So Brian Hatch came up with $700,000 in CARES money. We supplemented that with $500,000 of our own money. What we created was a situation in which we could fund a COVID aid in every one of our schools. So we have 140 COVID aids in our schools because of the relationship we have with the Davis County Health Department. Here's Brian Hatch to tell you more.
Hi, my name is Brian Hatch. I'm the Director of Davis County Health Department. I've been with the County Health Department for just over 25 years now and been the Director for the last just over 4 years now. COVID-19 has definitely been, in my career in public health, been the most challenging. A few years back we had H1N1. But it didn't have this complexity to it. To really do effective management of the disease is we look at now the circle around that individual. That's what we call contact tracing. And to do that, you interview the person and say, okay, where you've been during this period of time. And then we reach out to those individuals and teach them, educate them on that they've been exposed, and ask them to stay out of population because they're potentially going to become sick, and so that breaks that chain of infection. Well, that gets difficult in a school setting. The county received funding from the CARES Act, and so I thought it was a great idea for us to help the school district, giving the school district access to this funding to hire COVID aides, as they're being referred to in the schools, which has been a great success already.
Probably about 2 weeks before school started, we did a virtual training with all of the COVID aides. And so my supervisor, Wendy Garcia, and I did this virtual training and kind of explained to them a COVID 101 very quick, and then also talk to them about the ins and outs of contact tracing. We have been doing contact tracing for many, many months now, and it's not an easy task, as you can imagine. And so having an insider in the school, if you will, who knows the scenarios, the classrooms, who can help us do that is enormously helpful.
I am April Tobler. I am the morning COVID aide at Clearfield High School. We will be at the front of the school to welcome visitors. We will do a quick screening ones you get when you go to the doctor's office. So parents can really help us by encouraging their students to stay home when they're sick and to encourage their students to social distance, not just in the classrooms, but at lunch and other activities. On the rare occasion that we do have a positive because of transmission that we're aware of, we haven't had to worry about contact tracing because we were able to get that student on quarantine before they were symptomatic. So it's helped slow the progression of any spread that we've had.
My name is Mike Moss. I'm an assistant principal at Woods Cross High School. As part of my role this year is the administrator over COVID procedures. With the help of 2 COVID aides, we get information from the Davis County Health Department on positive tests. From an administrative standpoint, it's really allowed us to get into classrooms and observe what's happening with the physical part of the classroom. It's changed, the education has changed, but change is not always bad. Change forces us maybe to get out of our comfort zone, and our students and our parents are doing that and being very successful at that. And the district support has been great.
The one thing we've learned in the last 7 months is that the decisions we make today aren't necessarily the decisions that we actually implement tomorrow or even the week after, because the virus doesn't stay the same. The virus continues to change, continues to infect different people differently. But what we do know is that we have prevented spread of the disease in terms of quarantined individuals, because we are only quarantining about a half to 1 student for every positive case, where other districts around us are quarantining 10 to 15 students per positive case. So our contact tracing clearly is keeping more kids in school by not having to quarantine, because we're getting on the job right away. And on behalf of the superintendency and on behalf of the district, we'd really like to thank our COVID aides. We have over 140 of them spread across our 90-some schools. Also thank all of our school nurses, for their continued work, our administrative points of contact, continuing to keep our schools safe and our students safe.